Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're talking about another major milestone in rare immunologic disease treatment, Joenja, the first and only FDA-approved therapy specifically for activated PI3K Delta Syndrome, also known as APDS. APDS is a rare but serious immunologic condition. Broadly speaking, it's a disease in which the immune system doesn't function properly. Medically, it belongs to a group of disorders called primary immunodeficiencies, and more broadly, primary immune regulatory disorders. At its core, APDS results from inherited genetic mutations, most often in PIK3CD or PIK3R1, that cause the PI3K Delta pathway, a critical signaling route controlling immune activity, to become overactive. When this pathway is overstimulated, the body's major immune cells, B cells and T cells, don't develop or perform as they should. This leads to an excess of immature immune cells and a shortage of healthy functional ones. As a result, people with APDS struggle to fight infections, often experiencing recurrent or prolonged infections that require frequent doctor visits or extended treatment. But APDS is more than just a problem of repeated infections. It's also a disorder of immune imbalance. The dysregulated immune system can mistakenly attack the body's own tissues, leading to autoimmune or inflammatory complications. Clinically, APDS can appear in many ways, and symptoms can differ even among members of the same family. Common features include recurrent and severe sinus, ear, or lung infections, sometimes leading to bronchiectasis, a form of permanent lung damage caused by repeated inflammation. Some patients develop enteropathy, inflammation in the gut that causes diarrhea, abdominal pain, and nutrient loss. Others may have autoimmune cytopenias, where the immune system destroys its own red or white blood cells or platelets. Certain patients may also experience growth delays or neurodevelopmental issues as part of the disease spectrum. In many cases, due to ongoing immune dysregulation and abnormal immune cell growth, patients also develop enlargement of the lymph node, spleen, and liver. Importantly, APDS is a progressive condition. If not properly managed, it can worsen over time, leading to organ damage or even lymphoma, a type of blood cancer that occurs when immune regulation is lost. The good news is that now we have a novel therapy. Joenja goes beyond symptom control. It addresses the root cause. By targeting and calming the overactive PI3K Delta pathway, Joenja helps restore immune balance at the cellular level, allowing the immune system to function more normally. So, let's go through the 5 most important things every patient and caregiver should know about Joenja. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Joenja and who it's for? Joenja, or Leniolisib, is a kinase inhibitor approved by the FDA for the treatment of activated PI3K Delta Syndrome, abbreviated as APDS, in adults and adolescents 12 years and older who weigh at least 45 kilograms. Unlike conventional therapies that only manage infections or secondary complications, Joenja represents a major advance in the treatment of rare immunologic diseases. It directly targets the overactive PI3K Delta signaling pathway, addressing the underlying immune mechanism of APDS rather than simply providing supportive care. As the first and only disease-specific therapy for APDS, Joenja offers patients and families a truly targeted and transformative treatment option. Second, how does Joenja work? In a healthy immune system, the PI3K Delta pathway regulates how B cells and T cells grow, mature, and fight infections. But in people with APDS, mutations in the PIK3CD or PIK3R1 genes make this enzyme hyperactive, overstimulating the downstream AKT and TOR pathway. The result is uncontrolled immune activation, poor cell maturation, and a disrupted immune balance, leading to both immune deficiency and immune dysregulation. Joenja works by selectively inhibiting PI3K delta, calming this overactive pathway. By blocking the enzyme's active site, it helps normalize immune signaling, allowing B cells and T cells to develop and function properly. In clinical studies, patients treated with Joenja showed reduced lymph node enlargement and a more balanced B cell profile, reflecting measurable restoration of immune health. In short, Joenja acts at the source to correct the immune imbalance that drives APDS, offering a true disease-modifying treatment. Third, let's talk about dosing and administration. Joenja comes as a 70 mg oral tablet taken twice daily, about 12 hours apart, with or without food. Treatment is approved for patients 12 years and older who weigh at least 45 kilograms. There is no recommended dosage for those weighing less than 45 kilograms. If a dose is missed by more than 6 hours, the patient should skip that dose and take the next one as scheduled. If vomiting occurs within 1 hour of taking Joenja, another tablet should be taken as soon as possible. If vomiting occurs more than 1 hour after dosing, wait and take the next dose at the regular time. And this is very important. Even if Joenja makes you feel better, do not stop taking it without medical advice. APDS is a progressive disease that can worsen if treatment is interrupted. Finally, Joenja should be avoided for patients with moderate or severe liver impairment. Fourth, let's look at pregnancy and breastfeeding warnings and important drug interactions. Joenja may cause fetal harm based on animal studies. Pregnancy status should be confirmed before starting treatment. Patients who may become pregnant should use effective contraception during therapy and for at least 1 week after the final dose. If pregnancy occurs or is suspected, they should contact their healthcare provider right away. Women are also advised not to breastfeed during treatment and for 1 week after the final dose, since it's unknown whether Joenja passed into breast milk and could cause harm to a nursing child. When it comes to drug interactions, Joenja is primarily metabolized by the CYP3A4 enzyme in the liver, meaning certain medications can significantly alter its levels in the body. Strong CYP3A4 inhibitors, such as some antifungal drugs, can raise Joenja concentrations and increase the risk of side effects. So this combination should be avoided. Conversely, moderate or strong CYP3A4 inducers, including certain seizure or tuberculosis medications, can lower Joenja levels and reduce its effectiveness, and should also be avoided. Joenja can also increase the levels of medications that depend on BCRP, OATP1B1, or OATP1B3 transport proteins, such as certain cholesterol-lowering drugs. So concurrent use should be avoided as well. Because of these potential interactions, patients should review all their prescription, over-the-counter products, and supplements with their healthcare provider before starting Joenja. And finally, let's review side effects and safety. In clinical studies, Joenja was generally well tolerated, with most side effects being mild to moderate. The most common adverse reactions seen in more than 10% of patients were headache, sinusitis, and atopic dermatitis, a dry, itchy rash just like eczema. Other side effects seen in around 10% of patients include fast heart rate, diarrhea, fatigue, fever, transient hair loss, and back or neck pain. It's worth noting that because APDS is rare and study populations are small, these reported rates may not perfectly represent real-world experience. Some patients experience a decrease in neutrophil counts, a type of white blood cell, but no severe cases or infections related to this change were seen. Weight gain was also noted in a small number of patients during long-term use, with some becoming overweight or obese, so continued monitoring is recommended. In post-marketing experience, hypersensitivity reactions, including rare cases of anaphylaxis, have been reported. Patients should seek immediate medical attention if they develop signs or symptoms of a serious allergic reaction, such as rash, swelling, or difficulty breathing. Joenja may reduce the effectiveness of life-attenuated vaccines, so patients should consult their healthcare provider to plan vaccinations appropriately. Overall, Joenja has demonstrated a favorable and reassuring safety profile, and most patients tolerate well, allowing meaningful recovery in immune system. And there you have it, 5 key things to know about Joenja, the first and only FDA-approved therapy for APDS. For many patients and immunologists, Joenja represents a true precision medicine milestone, a targeted, disease-specific therapy that acts directly on the PI3K Delta pathway to address the root cause of APDS. Taken as a twice-daily oral tablet, Joenja has demonstrated strong clinical benefits and a proven safety record, marking a major step forward for individuals and families affected by this rare immune disease. Living with a rare disease can be difficult, and it's normal to feel alone at times. But remember, you are not alone. Many others share your journey, and new therapies like Joenja are bringing hope and connection to the APDS family. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.